Well, then in that case, we'll move to histology. That's the tissues. That's the last chapter before the test. And then afterwards, we're going to do a little test review. We're going to, as much as you want.
Is this on the test?
Very little. Like 3 questions out of 55. Because the test is Wednesday. So I don't want you to get too crazy about going nuts on this. But we will talk about them. We have 4 major tissues. Those are the fabric. They call it the fabrics that make us up, that compose us. What's important there is though the tissues are made of similarly differentiated cells and intercellular substances. Inter means in between. So they're not intra. Yeah, you should have a log of all these names I talk, all these prefixes and suffixes. There's actually little booklets you can buy that have all them in it. It's kind of nice because the words are created, and so it helps. It helps slow down the process. I was talking to the head of the department, the old head of the department, that was here when I started teaching, and we were talking about online classes and we were talking about studying, and he says, you know, it's like so hard. I gotta read things over and over because within a minute or so, I'm like, whoops, going somewhere else. My mind, if I was just reading. I'm like, God, did you do that? I thought that wasn't the academic bit. I thought it was only me. So if it happens to the academics, like, it's kind of everybody has that. And so, yeah, the word combinations and slowing down and reading them really carefully is very helpful in anatomy and physiology. So inter means in between, intra means inside. We have 4 different types of tissues. We have muscle tissue. Muscle tissue really does one thing. It contracts. It shortens. A muscle is attached to 2 bones, most of them. Some more than 2, but 2 main places of attachment. And it contracts, one place doesn't move, the other place moves. I can bend my elbow, hooray. And then I got one muscle in the back that straightens it out. And this muscle only brings the elbow in. It does not do anything else. It just passively lets this muscle lengthen it that brings the elbow back out. So you got these 2 opposing things. With every joint, every movement you have that. Because muscle only shortens, only contracts. Nervous tissue, so that's a whole tissue type. So great, one checked off. We'll do that later. Maybe we do muscles, we do that. Nervous tissue, well, that's your nerves. Have you hit your funny bone? That's the nerve. It's like electrical stuff. It senses, it conducts, and it stores information. So it sends that through electrical signals. But basically, it picks up something from the environment or the inside. Look, there's light. And it conducts it, that's the electricity, goes to the brain, at least to the spinal cord. Like if you do the reflex, have you ever done that reflex? You know, I had a patient, and he was like in his mid-50s, and I did the reflex, and he says, you guys really do that? I thought it was only in the movies. It was so funny, I was like, yeah. That connection mainly goes to the spinal cord only. It's too fundamental. And then we see it, and it's like, why did this move? And then we go like, we pick it up here. So nervous tissue does that, and then it also stores information. Like you can remember stuff. Aren't you amazed how much stuff you already remember from this class? I don't know. Or don't remember? And you think you have to? And then the complicated ones. So we have muscle, nerves, and then we got epithelial, and we got connective tissue. Connective tissue is kind of like, feels like it connects things together. That's how I remember it. And we'll go more in detail. This is really a weird, big amount of tissue in here. Epithelial tissue is a little bit more, I guess, not as, well, it's also very common, but this is like, in connective tissue, you got bone and you got blood, it's the same tissue. You go like, how is that possible? It's totally looking different. One's flowy, the other one's like making a house. Epithelial tissue is a little more together functionally. So what the epithelial tissue does, it covers us. It's like the skin is part of that tissue type. It lines our inside, so every tube goes through your body, everywhere where you have a bladder, where you have lungs, where you have blood vessels, where you have an inside of the heart, everything that has an inside like that has a lining of epithelial tissue there. And then the other thing, epithelial tissue is glands, you know, the sweaty stuff, that's epithelial tissue, and sensory receptors. So actually stuff that picks up the nose, the smelly stuff in the nose, that's actually that type of tissue. It's not nervous tissue. Once it reaches into the brain, it gets electrical, that is nervous tissue. So there's a little bit of ambiguity there. But we're not going to go too deep to worry about that too much. But it covers like the skin, it lines like the blood vessel, and it are the glands, so we're sweating with it. Some glands don't sweat. Some glands do that oily stuff that goes into the hair. All the hairs have a little oil gland going to it. And then the other ones are the hormonal glands. And those are the ones that squirt hormones into the bloodstream. Those are also that tissue type. So they're also glands. We'll have a whole chapter on those. On both, those mostly. And then connective tissue, that's very diverse. We have blood, is that, fat is that, bone is that, cartilage is that. So what I often think like it connects us together. The blood travels through the body, connects us together that way. The bones, make sure everything stands up and connects us, that kind of stuff. But it's a little more esoteric than, we just have to understand that the components of it. That's the main thing, and then we can go to the examples. But let's start with epithelial tissue. I don't want brown as my color today. We'll do red. Epithelial tissue, functions. When I talk about stuff, function is always a very important question. How it looks and what does it do? And so generally, and then afterwards, it's how does it do that? That's also a question that, of course, needs to be discussed in many parts. But functions of epithelial tissue is one of them is protection. Epithelial tissue covers us and protects us that way. Epithelial tissue in the skin is like many, many cells of layers of cells that start at the bottom, go up, as the top layer, and the top cells are actually dead cells. So if you bang into something, they just come off, they just fluff off. So that way you don't hurt yourself. So that's protection. Epithelial tissue absorbs nutrients. The gut lining is epithelial tissue inside the whole food tube. So the gut cells, which is one question somewhere which I did not answer yet, the gut cells help break down the food by having enzymes on top of them that sort of break down the foods. And then they absorb the food molecules. That's the other thing that they do. And then they bring that food molecule to the bloodstream. And that's actually right here. Let's write one of these things. So absorption is important. And then secretion is what glands do. They make sweat. That's called secretion. They make hormones. That's called secretion. So I have it here actually. Some go to the exterior, like the sweat, and then some go to the bloodstream, like the hormones. And then the last function, or the four functions here mainly, are the sensory. And that's for example, the retinal eyes. The eyes in the back of the eye, they take the light, and that transition from the light to the electricity, that's that. And then the impulse gets sent, and then it's nervous stuff. That's really cool how we see. We have a little bit of that. I have a good picture of that. It's like a chemical molecule that changes. It's like crazy. Oh yeah, look, right in here. That stuff. I like this, I shouldn't forget it. Epithelial tissue connects us to the environment around us. We can sense things with the epithelial tissue. It protects us to the outside. The gut is actually outside. The food to the butt is a tube. You're a donut. Did you know that? Like you got a hole in the middle from here to here. This is a long donut, but you know that. So technically speaking, they call that the topological exterior. So it's the outside. So then, you know, it protects us to the outside. So anyway, very often it's the last place the inside of the body has to the outside is epithelial tissue. Characteristics. How does it look? How does it behave? Let's talk about that a little bit. So one thing is epithelial tissue is basically cells right next to one another. You've got cell after cell, cell. There's a kidney tubule, I believe. Cell after cell after cell. So it's very cellular. There's only cells, really. There's nothing else in that. Then we got a basement membrane. We call that a basement membrane. Epithelial tissue always attaches to connective tissue underneath it. So on the bottom, you got what they call a basement membrane at the base. And then this tissue here, this stuff in here, becomes becomes connective tissue. So it always attaches to underneath connective tissue. That connective tissue anchors it. It does more than that though, it also feeds nutrients to it because one of the things that happens with epithelial tissue, it has no blood supply. There is no blood going in it. It's good because otherwise you bang in and there's blood and there's all bleeding all the time when the skin cells fall off. So you don't want blood supply in there. But that means that blood brings food. That's why we need blood. Without blood, no ATP, no oxygen, no food, no ATP. That's a bad thing. So it's the blood vessels inside the connective tissue that bring the food to the epithelial tissue. And then we have attachment makes a top and a bottom surface. So because we have this basement membrane here at the bottom, the top's going to look different than the bottom. So it's just we have two different surfaces that we talk about. Well, the basement membrane we just talked about. The top will have some more talking to do. And then it's very regenerative. If it has if it's well fed with food, it regenerates really easily. Thank God, because this is skin. These are all layers of cells. We got to keep pushing them up, because we bang it into stuff, they fall off. We don't want to get too far below and then go to the underneath tissue, which is going to be connective tissue. Don't want to do that. See, this is a little more in the gut. You see these cells are long. Well, I don't know if this is actually not the gut. This is somewhere else too. See, in the anatomy books, you're going to have all these examples in the big anatomy books. Like if you do a Bio 2, or even a 20AB, you're going to get into all the examples. One of the things that bothered me when I did these classes was like, well, you do it in the 3rd chapter or the 4th chapter, whatever. I don't know anything yet. And so I have all these examples where what is. So I'm like, no, we're turning it around. We're just doing the basics of how it looks and what it does and where it's at. And then the examples, we'll do those when we talk about the tissues. We talk about the different parts. Then it's more sensible, I think. Anyway, these cells, it's all cells in epithelial tissue. These cells come in different shape. They come in a shape that's a cube-shaped, a cuboidal shape. That's like the cell is about as tall as wide. It comes, here's a cuboidal one. It's good for absorption and secretion. It also comes in a longer cell, in a column cell. Here, this is the simple columnar. See this here, tissue here, the cells, on this one the cells go all the way up and down. On this one, the cells do go all the way up and down, but the nuclei are in different levels, so you're thinking it's more confusing looking. It's like more multi-layered or something like that. So this is actually that tissue type on this page. So columnar, the column shapes are pretty good for things where there's a little bit more abrasion. These are good for liquid goes through, like these are in the kidneys. They're small, and these are longer, and they're more. They can take more abuse a little bit. So that's more where food is at. So maybe the gut lining is like that. And then we got squamous, and squamous is like fried egg looking things, and that looks very flat. The nucleus is in the middle, like an egg kind of thing that you make in a pan. That's great for diffusion. Very thin. That's in the lungs, the air sacs of the lungs, where oxygen has to just go right from the lungs to the bloodstream. That's right where we have that stuff. We also actually have that in the skin. That's also the skin. But what plays into there is the fact that we can have a simple layered cell, like in that lung, or also in the gut, or we can have stratified. That's multiple layers. So the lungs and the skin are the same cell shape. They're both squamous, but one of them is multi-layered, so it's good for protection. The other one is simple layered, so it's good for diffusion of the oxygen. So what you need to know with this, stratified, multiple layer, protection. That's your flashcard right there. Or that's my test question. Maybe, actually. I don't know if it's one, but that will be it. I said there's a basic surface and the bottom surface and the top surface, because the bottom surface is attached to the basement membrane. So on the surface, on top, we can have different things. We can have different extensions. So it could be flat, or let's see the flat. See, it could be flat. This is flat, right here in the kidney. This here is fuzzy looking thing. So there is different things on the surface of that. And so we have three different ways, see the different things we put on the surface. One is known as microvilli. So these are little hairs sticking out of the cell on top. And they increase the surface area of a cell, because if you have all this going up and down, you have much more surface area than if it's just straight. And of course, that would be great because you want to absorb food molecules, so the more surface area, the faster and the easier the food gets absorbed. So that's great. So that's what we have there. Microvilli are good for absorption. There's your flashcard. Microvilli absorption. Like that. And then you have an example. Then cilia are things that stick up from the cell surface, and they're longer. And they're like whips, and they can do this whipping motion. And when they whip, you cough out the mucus, because they're right there in the trachea helping that mucus come out. They're whipping it in one direction. So the whipping motion brings everything in this direction over here. And so that moves substances past the cell unidirectionally, like the mucus in the trachea. And then the other one that we talk about, we'll bring it up here, but it's not part of the epithelial tissue. It's actually in the body only part of the spur, because it's the flagellum, and that moves the cells around. But the only part of the body beneath that is the spur in the guys. And so that's the third cellular extension that we talk about when we talk anatomy. So it's microvilli, cilia, and flagellum. Different functions, different things. And look at that, that's a nice picture, that's all there. Because then the next topic is these connections between the cells. So there are cell junctions. And neighboring cells from different types of junctions depending on the need. So cells, this is all cellular, it's just cell after cell after cell. And so some cells need to be very tough, like the skin. You don't want the skin to break when you pull on it. So you're going to have cell in between the cells. You've got to hold hands and make it nice and strong. And so we have these desmosomes, they call them desmosomes, and they anchor the cells to one another. That's a desmosome over here. See how that stuff goes through it, it really holds it tight. So like, holding hands real tight. And then we get tight junctions, and they are little things that make sure no liquid goes through it. So they make the cells watertight. Oh, look at that. They broke it up. Impermeable between them. So this is great because like if you put water on the skin, you don't want the water going down into the body. You want it to stay away. So we're going to use those suckers to make it watertight, nothing go through it. That's perfect. Skin's a good example. And then we got the gap junction. And the gap junctions, we don't really talk about those in epithelials. We're going to see those in the heart muscle in particular. I bring it up here because it goes on to this junction topic. And the gap junctions, they leave a gap between the two cells. So they have, look and see here, this is a gap that's closed, and then here it's open. And when it's open, it transports material between the cells. So a good example is the heart. The heart is a muscle, but it's many muscles. It's not just one muscle. It's many muscles on the inside. But have you noticed they all contract at the same time? How do they do that? That's crazy. They all talk, rhythmically, all the time. And so they do that by having an electrical impulse going through the whole heart muscle, through these things from cell to cell, through these gap junctions. So that's where we need gap junctions very heavily. And so that's a pretty cool stuff, actually. Nifty, I would say. Good, and that brings me right back to the glandular. Am I going too fast? You're good. No, good. Let's go faster. That's what we get. Do test stuff. Get out of here. Glandular epithelium secrete substances that lie within other tissues. So when we secrete things, what we want to do is we want to understand the fact that we have glands themselves that only secrete hormone things into the bloodstream. We call them endocrine glands. Endo means inside, so there's another word we can work. Endo means inside. When you see the word crine means gland. So the endocrine glands secrete the stuff into the bloodstream, and then we got the other glands, and you see here some glands, and you see here there's like channels that go up to the end of the top, but that's the surface. And those are exocrine glands because their stuff that they make exits. Exo means like exit, get out of here. Where the exit is. And so that's why they use that word. So that's, for example, sweat glands. But it's the epithelial cells themselves, and most of them are cuboidal cells, they make the stuff. And they make the stuff for both types of glands. And so now that's good, because now you know, if somebody says gland, you say epithelial tissue. It's good to have big categories that make us understand this material. That's why I'm doing that. And then the sensory epithelium, so the glandular is one, they make the stuff, the substances, and the sensory, they pick up and transform a stimulus, an arriving stimulus, into an electrical signal. And that's, I just said that before a few times, so that's just a slide for it. And here you get different examples, like the skin stuff. We have different, we have poking, we have pain, we have the temperature, we have light touch, we have deep touch, we have different types that transduce different sensations into the brain that make us appreciate and understand the world on the outside. And then this is the smell. This is the top part of the nose. This is the bone at the top of the nose up here. And as the smell comes up, we breathe it in. The particles get picked up by these extensions on these cells. There's a little bit of liquid in it, and then the electrical impulse goes up. It gets transduced in here and goes up, and from there it goes to the brain. We'll talk about that when we do the brain. That's cool stuff. Very cool stuff. And that gets me to connective tissue. So that's very diverse, common embryonic origin. It's the same place made in the baby stuff. Well, that's what they say. I've never really fully tested that. What I have though is know for sure is its composition is where we want to go with that, because it's not just cells now. Now we have cells and intercellular substances. So we have what they call it inter, means in between, right? Cells. They can of course also call it extracellular substances. So they call it the extracellular matrix, extracellular matrix. Have you heard of ECM? ECM tissue stuff, like when they do in surgeries and so, they have these fabrics of tissue made? No? Never mind. It's okay. And some of that sort of stuff. They call that ECM. They're like extracellular matrix. And the extracellular matrix is made up of fibers and of ground substance. And so that's where the diversity comes in into the tissue. So you always have cells in that tissue. That could be cells of red blood cells, or that could be bone cells. And then you've got fibers. That's a little hard to see in the blood where the fibers are, but in the bone we can then see that much easier, the collagen fibers. We'll talk about that in more detail. And we have ground substance, and the ground substance in the bone is calcium. In the blood, it's water, it's liquid. And so that can be all kind of stuff, but it gives us these components. And that also, of course, then gives us the grounds for all these diversity things. Look at all this stuff. So first, let's talk about fibers. We have 3 different fiber types we talk about. We have collagen fibers. Those are steel. They are as strong as steel or stronger. They are non-distensible. You cannot pull them apart, like your ligaments and your tendons. You know, a ligament is in between bones, the connections between bones. And then a tendon is the stuff here that is between the muscle and the bone. Like the Achilles tendon back in the heel. That's a tendon. So that stuff is hecka strong. You can go up and down. It puts my whole body weight up. It's all holding together. That's collagen, non-distensible. Then we got elastic fibers. And elastic fibers, they're elastic. You can pull them apart, like the ear cartilage. You can twist it and turn it and go back. And your grandmother says it won't go back, but it always does. Distensible, that fiber you can pull apart about 1.5 miles of the length. So yeah, ear cartilage. And then the third type is reticular fiber, and those are flexible fibers that make a sieve-like structure, like in a lymph node. So that's a type where you have to hold things in place and hold it together, where things can sit in. Like a lymph node is the blood system pushes the blood outside into the tissues, and then it has to come back to the heart so the blood can get pumped around all the time. The vascular system, the veins pick up most of it, but not all of it. Some of it is picked up by lymph nodes, or lymphatics, not lymph nodes. And then the lymphatics, the lymph goes through the system, and the lymph has to go through these filters, these little lymph nodes that are, in them you have a lot of white blood cells that sit there and filter the lymph that comes through it. And they can sit in there because there is this stroma, there is this sieve made that gives them structure to hold on to. And so that's maybe scaffolding is another term. So those are the 3 types that we use: collagen, elastic, and reticular. And in all the connective tissue, you have one of those types in it or more than one of those in it. Well, except in blood. Blood's going to be different. We'll talk about blood and a whole topic. Because if you have fiber in blood, it's always making the blood sticky. That's very dangerous. So we have to be very careful about fiber in blood. But look at that. Tissue types. These are the names. One type is called loose areolar tissue. Have you ever skinned a chicken? Shiny underneath the skin? It's that stuff. So that forms sheaths of fabric surrounding organs that connects them to one another. It stores a lot of water. That's why you want to hydrate, one of the reasons, so that things can move around. And allows other tissues to shift around. That's a room to shift. The body comes in layers. So when you take the skin off underneath, you got that sort of thing, and then under that, and you got adipose, and then under that you got muscle. And under that you got more bone. Everything is layered. And between the layers we got that loose areolar tissue. Yeah, I mean, I have this therapist. He does this active stretching type stuff. It's very, very good. And he has a patient that we share, and he has a prostate cancer, or yeah, I think it is, or early stage or something like that. And he tells me that in their theory, in their logic, in their technique, and they've proven a lot with studies, unless the prostate adheres to the bladder, they don't consider it as a problem with cancer. Once it adheres to the bladder, it goes all nuts. And it's like, nobody else talked to me about that ever before. I can't disprove or understand, but they advocate a lot of water drinking because then this is hydrated well and everything moves around well. And so we definitely know movement is better. That's all I know from that sort of thing. I can't prove or disprove the other statement, but it was definitely very interesting what he said. I did not expect that. And so that was another reason, like, yeah, I do want to drink my water. So that's loose areolar is all over the place. Adipose tissue is our energy storage and structural support fat. The kidneys, for example, have little fat around it. That's structural support. We need that. Well, that is like kind of a brutal picture. I think that's from Herbalife, actually, originally, that picture. That is, I think, BMI 20, BMI 50. You see all the white stuff, that's the fat. The problem becomes this, the organ crowding. That's the problem. That's the problem in here, different. So that's where we want to, they talk about that where it actually is more important. Your BMI, height, weight, not so important as this measure around the outside where the hip bone is, and then measure around where the belly is, and then gives you the hip fat versus the belly fat. Hip fat, fine. Belly fat, So that seems to be, from a cardiovascular perspective, a much better measure than just the BMI alone. We can talk more about that, and I can bring you in those numbers. I don't have them offhand in my head. So that's another type. Then adipose is fat. Dense fibers, has a lot of collagen fibers. That makes, that's dense. That's your ligaments. That's your tendon. That's the Achilles tendon right here. Then we have blood. We'll talk a whole bunch about it. Then we have reticular. We just talked about that. Lymph node, as an example. We just talked about that. I don't think I'm going to hold you responsible for all these names. Make sure you don't study this chapter as in memorizing before you look through the review. A lot of this is not testable. And then we get to cartilage and bone. And I think the couple of questions I have in the tests are actually mostly from here. I'm not totally sure, but I think so. We can look at the end. Actually, we can look right now. We can look right now. Yeah, the introduction lists the tissues with examples is on the test. Shapes and arrangements of epithelial tissue, and then the osteon at the end. So the rest is FYI. You will need to know it for later. It's integration information, but not testable. So, but that brings us to cartilage. Cartilage is found in the skeletons. So these are the types of connective tissue that we have in the body. Now we're going to do a little bit more detail on cartilage and on bone, because that's on the next chapters that we're going to talk about after the test. And then muscle and nerve, we're going to talk about that when we talk about those chapters. We're not going to go through all the details here. But cartilage is found in skeletons and airways where we need stable yet flexible structures. Like the nose, you need stable and flexible. Like here, cartilage here in the ribs. You need them to be stable and hold those lungs together, but you also need them to have a little breathing room. They need to move a little bit. So we have them here in the ribs, we have them in the nose, for example, but we also have them heavily at the ends of bones. The covering at the ends of bones we have them there, and they make movement easier and less painful. If you have a knee that's arthritic, it's bone to bone, you know what we're talking about. Also an example for cartilage that we have that's really cool is the tracheal rings in the airways. So here, behind the Adam's apple, there's air going up and down. And then behind the air, there's the food going up and down. And so the air is very light. You know, food is like bulky. It just pushes down. Liquid just pushes down the tube, pushes the tube apart, and it goes down. Air is not going to push that tube open and you get it into the lungs. That's way too crazy. So there we have these rings that are halfway around to the front, and they keep that tube open so we can breathe. So the windpipe, the trachea. So that's kind of cool. That's a very nice, nifty way for cartilage. That's sort of just, well, we have a few different types of cartilage. We have hyaline cartilage, we have elastic cartilage, we have fibrocartilage. Let me see, do I have a slide on that? Yeah, I do. So, but first I want to talk about that, and then we can talk about the types. Because cartilage as a whole has a high resistance to pressure and is capable of viscoelastic deformation. That's an earplug. You squeeze it and it slowly comes back. That's viscoelastic, so it can move. It can, but it resists pressure. That's why it's great for a knee joint. It moves a little, but it pushes, it's almost like it pushes back. It doesn't just sink in. So it's very resistant to that. We have cells that live in cartilage. They're called chondrocytes. Chondro means cartilage. Anything chondro, cartilage. Cytes means cell. We talk about that. They live in the cartilage. The cartilage is very dense material though, so the cells can't really move freely around, so they make them little houses, and they call those lacunae, or also chondro. I haven't heard chondros in a long time. Lacunae is the word I always hear. So that's a little house. A lacuna is a little house for a cartilage cell. A cartilage is avascular. No blood vessels go there. That's what avascular means. That makes sense. If you have blood vessels going to the knee cartilage and you're always walking on that, you're bleeding all the time. That would be bad. However, no blood, no food for the cartilage cells. They're going to starve. We don't want that. So they are fed by diffusion or directly by synovial fluid in most joints when we move. So diffusion means the stuff needs to go through into the cells. And how we're going to do that in the cartilage is, cartilage holds a lot of liquid. Like a knee cartilage is mostly water, trapped water, because water has all these great properties. And so when we walk and we squeeze that cartilage, we squeeze SpongeBob and all the water goes out. And then when we let go and we lift up the knee, it sucks it all back up. But it changes around. It feeds it so that the used up stuff can leave and new fluid can come in. And so that's how we do that in the cartilage. That's very, very important because avascularity makes regenerative capacity of cartilage insignificant. So which means when it's broken down, it's broken down. So in the old days, they say somebody with bad knee cartilage, don't walk, don't abuse it, keep it. They all got fat because they didn't move. So then you move with all that weight, guess what? It's not going to be good. And also, when you don't move and you don't do this with the cartilage, it degenerates automatically as well. So that's the fun part for the couch potato, unfortunately. Don't use it, you lose it. So we have different types. We have hyaline cartilage, we have elastic cartilage, and we have fibrocartilage. Hyaline cartilage looks like that. Okay, ground glass appearance. Where is it? That's more important. It's the surface of joints, and it forms parts of the ribs, the nasal septum, the larynx, the rings of the trachea, and the large bronchi. Okay. Just a list of stuff. Basically, the biggest part for us is it's wherever there are the bones. The hyaline cartilage is the end of the bones. In the ribs, the end of the bones. Nose, the end of the bones. So that gets you pretty much everywhere. The cartilage rings, the tracheal rings are, that's a little different. But then elastic has a lot of elastic fiber in it, looks more yellowish like this. That's your ear. Bing, that goes back. That's elastic heart. So it doesn't, you know, the nose. Until you do too much and it breaks it, don't do that. Then we got to go in with the balloon and straighten it back up. And then the last one is fibrocartilage, and fibrocartilage has a lot of fiber in it, so it's very tough. That's Tupperware, tough. That's like, have you heard of the meniscus in the knee? Anybody know meniscus? Yeah. So meniscus in the knee is like a really interesting situation. You have these bones that come down, and then there's plateau here. They sit on the plateau. So it's like this on a plateau. It's not like that and does this. It doesn't do that. It's like a plateau and it moves on like the plateau. So the top moves. So you have these rings of cartilage that are thicker on the outside and they get thinner, the wedgie on towards the inside, and they guide the movement of the knee joint. So that's why when you have a little trauma and they get splints and break off, you have problem with your meniscus. And it really hurts because it's like, you know, the movement is off its own place. I had that once. It's really strange. So we have that, that's the meniscus here. We have that in the knee. We also have that between the vertebrae of the bones in the back. The disc stuff in the back, those vertebrae in between them, that's also fibrocartilage. So we'll talk about that when we get to those. That's some cool stuff too. And the pubic symphysis, that's the one in the front where the pubic bones come together. You learn that chapter 1. The area, the regional terms, is one of those. That's the only place where we have this fibrocartilage, this tough fiber. And so we go back a little bit. Here are all the different types. And then here they're like, you got a little color coding with it. So that's kind of helpful too. Oh, the epiglottis is also the thing in the, down here. So we differentiate between food and air. That's what that is when you swallow. That little thing in the back is also elastic cartilage. We'll talk about that when we start eating, which is the digestive chapter. That takes us a while. No, I think it's the respiratory chapter, actually. Okay, that then brings me to bone. Bone is the main supporting tissue. Besides the teeth, bone's the hardest tissue in the body. Stable under compression and tension and resists deformation. So, well, it's like a brick. You can't compress it, but it's like a flexible brick. So that's really cool because it bends a little bit, but it resists it. So gravity, we can play with gravity. It holds us up, but we can play with it. It doesn't just collapse. It has this bending force a little bit. Functions keep us upright, so supports with that. Make sure we don't just start a blob on the floor. Protects organs, like think of the brain or the lungs with the ribs. Because it's very tough. You can bang into it and it still doesn't. The brain's very soft. You don't want a brain not having a skull on top. That would be bad. You know the soft spot in the babies? Yeah, that would be bad. All the time a soft spot? It helps with moving us around. Locomotion is the term for that, like a locomotive. Moves us around. It's the passive parts. Like the bones is where the muscles attach. So if you have a muscle attached to here, it can straighten out your knee. The bone just stays there. The muscle moves. So it's that. But it's part of the movement apparatus with that. It stores calcium. Very important function. We need calcium in the blood to pretty much any time to survive. So it stores it. It also stores fat as well. And lastly but not least at all, it makes all type of blood cells. Red blood cells, white blood cells, and what we learn to be platelets later on as well. Lots of functions. Bone, so cartilage does not have blood supply. Bone has excellent blood supply. You know, compressing it. And so often a broken bone heals faster than cartilage stuff or even ligament stuff. The avascular stuff. When you hear avascular, no blood, you think slow healing. So that's a problem. So bone is actually a fast healer. It's not a slow healer. It's just pretty bad when you break an arm. You have to stabilize it. It looks, all of that. So the outside of the bone, every bone has a little skin on it on top. It's known as the periosteum. It's a membrane that it's like a stocking, like you put on a stocking around your leg. When we look at cells of bone, so it's connective tissue, so it's got cells. Those in the bone are interesting. They're dynamic. They often change because bone always changes. When you start walking, or you go for runs, or you be on gravity, your hip bones will arrange differently to accommodate the forces put on it. When you're just laying around, they do different things. So that's why you can't just go 100, 180. You have to build up to things. So bones are very dynamic. We have osteoblasts, and those are osteo. Whenever you see osteo, you think of bone. Osteoblasts are immature bone cells, and they make extracellular matrix. You think of calcium for the bone. In the bone, you think extracellular matrix. You got fibers, of course, but you really, the bulk of the bone is the calcium for us. And later on in life, when we demineralize the bone, we don't have enough calcium because we need it in the blood, and we get brittle bone disease, osteoporosis. Has to do with calcium. So osteoblasts make that calcium stuff. They put it down. Osteocytes are mature bone cells. They maintain bone that we have. They live in lacunae as well, like the other ones, the chondrus, like the cortisol cell. And then we got clasts, osteoclasts. And osteoclasts are bone removing cells. They break down calcium when the blood needs it. They're actually immune cells. They come from the immune system. When you think immune cells, you often have eaters. They eat stuff because you need to get rid of stuff you don't want, the immune system. So the osteoclasts come from the immune system, and they live in the bone, and they reside in the bone, and eat calcium and deliver it to the bloodstream when we need it. So we have cells that make the calcium, build up the calcium, build up the bone. We have cells that maintain the bone, and we have cells that break down the bone. And when I think of blasts, I think things that blast material out of my cell. I use the word blast and just have a little mnemonic in my head. That way I differentiate it with the clasts. And the extracellular matrix is collagen fibers, but lots and lots and lots of calcium containing inorganic salts. It's not just calcium, but the calcium is what we care about for the bloodstream. And the collagen fibers is very interesting. That's also an important component. So you got the calcium, that's the brick stuff, and then you got collagen fibers. And when you look at how it's arranged, bones come in these little things, these columns that are about a centimeter tall and very tiny, of course. And then many of them make up the bone. But each one of them has many different layers, like in a tree. You think of layers of a tree. And each layer in the middle has calcium, and then the cells sit in there. But then on the outside, you've got collagen fibers. And the collagen fibers arrange themselves in different directions depending on which layer you are. And that gives the bone this flexibility. So it can be a little flexible, but it's very strong, in like a brick. So it's a flexible brick, dynamic brick. So that's cool. All right, complicated. When we look at a typical bone, you're looking at one from the extremity, like a long bone. There's the main kind of type in the extremities. It has the three sections. It has a diaphysis, and it has an epiphysis on each end, and then in the middle it even has a metaphysis. Ha! So many words. It's not on the test. So, but you need to know a little bit about it. Physis means shaft. And so we got a big one in the middle, and then we got two smaller ones on the ends that make the joints to the other bones. And what's important about this situation here is right here, we got this part between the two main, the diaphysis and the epiphysis. Don't even worry about the metaphysis. And that's an area where the bone grows when we're growing up. So when you look at the bone starts small and the baby starts small and has to grow in length. And that's an area where we grow. And that's the epiphyseal plate. And the reason why that is important, if you're a parent, are you a parent? Yeah, good. Your kid breaks the bone, which we don't want. No, mine didn't, so hopefully yours don't. If they break this here, the epiphyseal plate, they're going to have problem with the growth. And so that's going to be very, very important for the doctors to make sure that's not disturbed. And so that's one reason why I wanted to discuss this. Don't break your epiphyseal plate. I had a kid, and that's where my kids were small too. And he was playing on the roof with some tools. I think his dad, I'm not sure what he was doing. But he fell off the roof. And he broke his femur. The whole summer he was in a half body cast. This kid is a boy, he needs to move and run around. And that's because he broke this in the femur. That if you break, you're gonna have to be very careful that you're not weight bearing. Be very careful how much weight you put on each bone, because those bones always grow in these kids. And if you're like 5, 6, 7 years old, then that really has an impact. And so that poor kid had to sit out the whole summer. I'm sure that dad got a lot of share at home. Types of bones. So let's do this. The basic building block of bone is an osteon. An osteon is this little small thing that's about this big and tiny. And it's a round cross section about 1 centimeter tall. That's this tall. And it's composed of spirally arranged collagen fiber sheets, which I just described, that different directions. And then the inorganic salts between them. And the sheets are laid crosswise, giving it strength and flexibility. And 10 to 20 of these layers make up an osteon. And so then you take all these little things and you make all these big old bone things out of it. So it's like a Lego piece. And then you make the bone out of all these Lego pieces. We have different parts of it. We talked about osteocytes already. They live in lacunae. They are connected via little channels. Where do we have one of those? We don't. A Volksmann channel. Oh no, those are canaliculi. Sorry about that. They're connected via very small little channels that they can actually communicate with one another. So the cells talk. They want to talk. They're like social things. They're like us. Then in each osteon, in the middle, it has a canal going up and down. That's known as the Haversian canal. That's just a word we have to learn. Not in this chapter, I don't think, for you guys, but some of them. And that carries a nutrient artery and a vein up and down. So as I said before, bone is very, very well fed with blood. That makes it very fast, regenerative, and all that sort of stuff. That's the deepest level. We have this blood going up and down. And then we have it go across layers, and they call that the Volksmann's canal. Those words, focus on the test and the understanding. Don't memorize all this little detail that I don't need to test you on. Got that? Just on those you learn the concepts. Concepts are more important. So now you got the osteon understanding a little bit. Now you take one of these small little things and you make different types of bone. So you can make compact bone. That is bone that has just osteon after osteon after osteon. Very, very strong bone. When you look at a bone, you're looking at a compact bone. Very strong, very heavy, but very sturdy. So that's good. That's an outer layer of bone. And then we have a spongy bone, or also known as a trabecular bone, and that's on the inside of the bone. When you break a bone apart, the inside's spicules. It's not that smooth thing like the outside. And so that's that kind of bone. That bone is like a scaffolding bone. A lot of air and a little bit of stuff that holds everything together. And look, that looks like that. There's like a few osteons going up here, then to the side, and those are those little spicules. When you see the spicules, you also have an understanding of how small the osteons really are. But that bone part is very cool because it gives us maximum strength with minimal material. And so this bone is very dynamic. Like if you start walking, the force lines of while these scaffoldings are put down, like how these lines are put down to hold the force that comes down together, that's very, very dynamic. Depends on how you expose yourself to gravity. So that's what I talked before about. So that's the two different types. The compact and the spongy. Oh, look at that. Battery's low. We gotta get finished. Talking way too much anyway. And from there, I think lastly, but almost lastly, when we look at all these bones, look at that skeleton over there. You got all these different bones. So we gotta classify the bones. And so the way we classify them, we give them different names for different shapes. And so, I mean, that's very rudimentary. So we got long bones. Long bones are longer than they're wide. Okay, that's cool. All extremity bones, for most of them, long bones. Then we got short bones. Yeah, great. They're like short, not as long. Okay, we get that. Wrist bones and ankle bones. They got flat bones. They're flat. The ribs are the ones you go, why the ribs? They're round. No, they're actually flat. If you go look at a rib, they're very flat. Sternum, chest bone is flat. And then I like this, irregular bones. Everything else, pretty much. So everything that's looking kind of goofy, it's not flat, it's not long, it's not short, irregular. So that's where we don't talk too much about these classifications after this moment. And then we got these sesamoid bones. That's another shape. That's an interesting situation. Sesamoid bones are special type of short bone that forms in a tendon to assist a joint's smooth motion. So if you have your patella, right? The kneecap. That's a kneecap. That's one of those bones. Is the kneecap. So and you got them all over the place. You got some here. You got some here. That's why I put this X-ray on. You got the big ones in here, definitely in the toes. So they help the motion pattern. The patella, though, is the one that's easy to understand. So if you think you got a muscle right here, the quad, and the quad goes right into here, and the quad does this motion, straightens out the leg, and so with the patella, the motion is very nice and round like that. If you don't have a patella, you have like the muscle here, and then a 90-degree angle going down, and going right into here. When you have a 90-degree angle, you're going to put a lot of force onto here to overcome that 90-degree angle, and then all of a sudden it overcomes it, and then the knee just jumps up. When you have a patella in there, I had a student once, her name was Martina Patella. It rounds the motion, it changes the angle, and you can contract this a little bit, and the movement is a little bit, and it's nice and smooth as a motion. And so it helps the biomechanics. It's a kinetic thing. It helps the biomechanics make a smooth motion of a joint. That's the reason why we have these sesamoid bones. So that's a little tricky there, but really cool stuff. Cool stuff. I know. I think it's cool. You think, get me out of here. Bone development, making bone. How do we make bone? The other words we can use for that is osteogenesis. If you heard of the Bible, you know the Genesis, Old Testament. Osteo means bone, so the creation of bone. Ossification is also a word that we use to make bone. We have two types we can make bone. One is known as intramembranous. And intra means inside, in between two membranes. Intramembranous. Like, you do that like the skull. You know soft spot, we talked about soft spot, right? That's the membrane. And then when the soft spot fills in with bone, then it's bone. That's that process. So you start with two membranes, like in the brain, and then you start having, originally that's just membrane, and then they start having ossification centers, they call that, in areas like here, the different skull plates, and here, and then they grow in and fill in where the membrane is. And with the fontanelles, the soft spots, that's just leftover before they close up. But we need them to be soft because the skull needs to be able to squeeze as it gets through the birth canal. And so that's why we have that. But you know how soft spot work, you understand intramembranous ossification. And the other one is endochondral. And the word endo means in between or inside, and chondral means cartilage. So this is the whole skeleton inside the womb is first a cartilage model. It all looks like cartilage. You've got cartilage femur, you've got cartilage, everything is cartilage. And then slowly that cartilage turns into bone. And how it does it, it basically gets a little center of bone, a little bud that starts making bone out of cartilage in the middle, and then we get some at the end of the bones. This is a long bone, so it's easy to explain. Like the vertebra just has like 9 or 10 of these different things, so it grows in different directions. That's how it is made that way. And then, they start hollowing out, the bone starts to grow, and so we have the middle section and the two end sections in this example in the long bone, and then we have this epiphyseal plate, as I talked about before, or epiphyseal cartilage, and that's a place where then the bone ultimately can go in length. And at the end of the day, this fills in with bone also, and then we know we are matured. Skeletal maturity, they call that then. And that's basically it. And everything else you read up when you go through this chapter again in another class, and then you have a baseline to start, and then you take it from there. All right, you got any questions to this? Good. What time is it? I've been really bad with you guys. 7:40? No, not that bad.